And let's bring in Dr. David Shusterman. He is a New York-based board-certified urologist. His office detects and treats prostate issues, including things like prostate cancer. Dr. Shusterman, thank you so much for being here with us. Look, as Peter's touched on there are a lot of layers to this story, right? It's a tragedy anytime you find out anyone has cancer, but given who this is, there are also questions that come with that about why didn't the public know? He did have a doctor, a great doctor you usually would expect for the commander-in-chief treating him. How could they have missed this? For those of us who don't have a medical background, take us through your thought process when you heard this news. Do you agree with what we've heard from some other medical professionals, that it's surprising and hard to believe that it wasn't noticed or detected earlier?
I fully agree with the oncologist that was on earlier. They basically said my thought process, which was when someone actually gets prostate cancer, usually it starts off very small and low grade, and then it progresses further. Sometimes you get it when it's higher grade, but still it starts out in the prostate and then it spreads from there. So we catch it early in the prostate, it increases survival to about 90% before it's metastatic. And then if we wait for it to kind of spread, then the survival goes down significantly. And so when I heard this, it's very rare for someone who's actively being monitored, such as the president, to actually get this metastatic prostate cancer at presentation. Typically, we see this in a VA population or an underserved population where they haven't been followed for 5 to 10 years, and then they present with, metastatic prostate cancer.
So typically, the way that this is monitored is you don't have to go in and say, I have a specific concern. You're saying this is something that is done usually, at least annually, varying, I'm sure, from patient to patient. But talk to me about what PSA means. That's a thing that can be detected in blood levels, correct?
Right. So PSA is just simply a marker that is only found in the prostate, and it is elevated in people who have a higher chance of having prostate cancer. So just because you have an elevated PSA doesn't mean you have prostate cancer, but you should get a biopsy to determine if you have prostate cancer if the PSA is high. You could also figure things out with an MRI, so if you do an MRI of the prostate or a transrectal ultrasound, or in this case, they said they actually did a digital rectal exam, which is also very surprising because typically it's rare nowadays for prostate cancer to be detected simply on a digital rectal exam. The questions I have here is, what are the PSA going back when he started being screening at age 50? So when we started screening him at age 50 to now, it's about 30 years of PSA data that we're missing. I think if we get that PSA data, it'll answer a lot of our questions. But of course, there's HIPAA compliance issues, so Joe Biden would have to release that data. And in addition, I would love to see his testosterone because he could have been on castration therapy during his pregnancy.
Let me ask you, is it possible, and some other doctors have told NBC News that it is possible sometimes for tumors like this to not produce PSA and therefore it would not have been picked up. Is that a possibility here as well?
That is a possibility, but remember, he also has benign prostatic enlargement, and they've been closely monitoring his prostate size and prostate nodules, and this is not the first time you would have a digital rectal exam in his life. He has it at least once a year. So then the questions are, was this the only rectal exam that showed a nodule, or were there prior exams that showed nodules? So, you get into the weeds here, but ultimately, most prostate cancer is diagnosed at an early stage. When it starts getting to be this late stage, we start asking questions like, how was it missed? And this was any patient. So if any patient comes to my office and we detect this kind of a cancer, which happens very rarely, we would have to go back and see, how is this missed? Because this doesn't happen often anymore. Thank God.
Yeah. Thank you so much for being here tonight and helping us understand some more of that. We appreciate your time this evening. Thank you.
Thank you.
We're going to head now to the current occupant of